Welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and CoreCute. Today's episode is number 2 of Season 3, and our guest is Paul Mastrapa, CEO of Help at Home. Paul has actually been in the home care business for at least 25 years and has a passion for and a fabulous history in in-home care services. One of his past accomplishments you might have heard of is creating Option Care Health, which has to do with in-home infusion services. So he has a pretty wide variety and spectrum of services with which he is familiar. Please help me welcome Paul Mastrapa to Help Choose Home. Paul, thank you so much for joining us today. First thing I'd love to do is for you to just give me a little overview of Help at Home.
Sure. Help at Home was founded here in Illinois, in Chicago, over 45 years ago, and, has a long history of, providing home care services starting in Illinois and now expanded to many other states. The company today has physical presence in 11 states. We actually touch about 13 states, touching over 60,000 clients with almost 30,000 employees. So in talking about Help at Home, I'd like to start, what our vision is. We really see seniors and people with disabilities living independently in their communities, which I think very succinctly highlights really what the vision is for the company, what we try and offer.
And you've also, though, in your past life, you've been in healthcare at home or some facet of it for 25 years plus, correct?
I have. I have a long history in what I like to say alternate site healthcare services. My whole career has been around providing healthcare services in community-based settings, typically the home, from home health to home care to home infusion, where I've spent a lot of my time. Think pharmacy-based services for people who are safely and effectively could be treated at home, to some hospice, as well as respiratory therapy and some DME services. So I've touched a lot.
Well, and generally people have either no idea. This is a consumer-focused podcast, so people either have no idea what kinds of services can be provided at home, or they have a limited idea. But from your experience, you have gone from non-medical, sort of lower skill services all the way through acute. Are there any barriers to providing services at home that you see?
Well, you're right in that there is a lot of misconceptions historically around what is home care or what is home health. Where often, the layperson, will think, oh, so you send nurses into someone's home. And until you have sort of experience with the different types of services, either through a loved one or individually, it is hard to kind of put a perspective to. And I like to say that home care is, the way I define it, is a broad range of services, right? Generally health-related services delivered typically in your home or other alternate site of care setting. So it could be medical, it could be non-medical, it could be with an acute issue, or it can deal with a chronic issue, or it can deal with both. And everything from end of life to needing equipment in the home, to either medications administered through a variety of settings, to bathing, dressing, grooming, and other kind of, skilled and therapy, services. So it is very wide ranging, touching, many, many different people in many, many different ways.
And when I ask you what's the most important thing that you think a consumer should know right now, you had an immediate answer for me. Would you like to share that with us?
Sure. I think it's important for the consumer, especially today, to explore all of their avenues of care. The healthcare system is starting to move towards prioritizing home-based care with a lot of the changes that have been helping. And think of the shift in risk that's been happening in the healthcare system that is creating, from physicians to discharge planners in hospital to health plans, to looking at the consumer in a much more holistic way. Historically, a hospital would focus on what is the clinical need, and we're going to take care of the clinical need, and then discharge the patient and hope for the best. Now there's a much broader perspective around what are all the issues that are affecting, the health status of our customers, our patients, and how do we support those issues? Because we know that if some of these other non-medical related issues, there's a term called social determinants of health, which I can talk about more, but if these non-medical issues aren't addressed, they lead to potentially negative health-related issues and additional needs for services or hospitalizations and costs in the system, as well as risk, to the consumer. So I would counsel a consumer first, educate yourself on the options. Talk to community resources, talk to your physician, talk to case management and discharge planning in the hospital or your insurance company, and really explore what are options. Sometimes those options aren't really well understood even by those parties, so you have to do your homework. And then research the providers that you want to use. One thing that many folks don't understand from the consumer level is you have a choice. You can choose who you want to use, and often make that choice with intention, based on doing homework around who the provider is, what are their quality scores, what's their reputation, et cetera, before you engage. No different than if you are, looking for a new physician or a new hospital. Is that helpful?
That is very helpful. And you said you would expand social determinants of care. So I'm going to ask you to do that, please.
Sure. So that's now a new fancy buzzword for all the other stuff in your life that could potentially make you sick, right? So social determinants of health. There's a lot of research that's happened here over the last number of years. In particular, you've seen this term now in the press and in the healthcare literature to a large degree over the last 5 years. The studies that have been done show roughly on average 80% of your health status is impacted by not necessarily your health, which could be so what do I mean? It could be your social situation, your financial situation, your living environment, your accessibility to food, or your accessibility to medication. Those factors are much more determinant on the level of your health status necessarily than, for example, I have heart failure or I have diabetes. So that, I think, realization, for us who have been in healthcare for a long time, this is the blinding insight of, I'm going to butcher it if I try, but it's very obvious. It's very obvious that, well, duh, right? If you're not taking care of all these other things, then you end up not being healthier. But the health system is now starting to shift, where even if you're a payer, you're starting to think about how do I help my members get medication if they can't. Medicare Advantage plans are starting to cover non-medical services and other social supports for these reasons, because and CMS is allowing those coverage. Medicare and Medicaid are allowing those coverages because they're recognizing that these other issues need to help be addressed for us to provide optimal support, right, to the health status. So it's an important concept, I think, that people need to understand that is now weaving its way into the healthcare system.
Well, and one of the silver linings, it appears to me, from this COVID-19 pandemic is that some of the rules and regulations in care at home have been relaxed or extended or changed so that it is easier to provide healthcare services at home.
You're exactly right. This is a fascinating time from a healthcare perspective that is, first, it's changing human behavior in ways that we haven't really even fully understood yet. From video conferencing, using technology to interact, right, much more comfortably and extensively than we ever did before. How we travel and why we travel. How we receive healthcare services. Telemedicine has been a field that has been a slow-growing part of healthcare that I think the doors are going to be are being blown wide open, right? Because now you have to. That's often the only way that you can see your healthcare professional is through a telemedicine visit. These changes in behaviors and new technologies are going to offer a wide range of new capabilities, for the consumer around how they access healthcare and where they receive healthcare.
The other silver lining, if it could be called one, is that the taking care of someone in home setting is more of a personal care situation, one nurse or one therapist to one person versus congregate care. And it seems that more people would prefer to have less risk, which would be less people involved in their care.
That's correct. As a home care company, in light of this pandemic, our services are more important than ever. Right. The majority of what we do is providing home care, which tends to be non-medical. Some people call it non-skilled. I don't use that term because our caregivers are trained and provide and often do provide supportive services that are hands-on, right, to our clients, like help with ambulating or bathing and dressing, grooming, those kinds of things. They're in the front line of really helping people stay independent in their own home. Our services exist to help keep people out of institutionally based settings, right, either nursing homes or assisted living facilities, by providing them the right level of care at the right time, before they have an event or a deterioration in their care, or to minimize the risk of having an event or needing to be institutionalized for any reason. More than ever, it's incredibly important. I see clients today that on one level are very concerned about anybody coming into their home, even our caregivers. But on the other hand, they recognize that these services are critical to helping them stay in their own home because, boy, the last place you want to be right now is in a skilled nursing facility or a congregate living center. I mean, what we're seeing in the news with how the pandemic is affecting, those centers is just absolutely, heartbreaking. And from my own personal perspective, my whole career has been a big believer in the home and pushing the envelope for how do you help keep people in their own environment. Because I think having that level of independence and pushing that as long as you possibly could is, frankly, drives a good quality of life and also a much better and longer functional health status, at least from my own experience.
And it sounds like, from listening to you speak, that you think that the trends we are seeing now will continue into the future and be a positive for the healthcare at home industry.
I absolutely do. Our industry has been growing, very quickly, primarily as a result of demographics. The aging of the baby boom generation, the growth in the over 80 population, increasing life expectancy. We can't afford to institutionalize, the growing population of seniors, nor should we. So there's a substantial amount of increase in demand in home care just due to nothing more than the population demographics and increasing life expectancy and chronic and incident rate of chronic conditions. So our goal is how do we provide a more seamless, more effective experience, right, for our consumers to help and leverage technology beyond even direct human support to help keep them there.
It feels like if there could be the opposite of the perfect storm, that's where we are now. That the perfect storm, if it is brewing in the congregate settings and in the hospital settings, not in the home setting right now.
That's very true. I saw an article around home care that referred to our caregivers as a rear guard, right, to the healthcare system. We provide an essential healthcare service. Our services are designated as essential healthcare services. And what we do today is extremely important because we're helping keep these folks acute care settings, right, and hopefully minimize the risk of events. So absolutely, it's critical. We view ourselves, and we are part of the team helping our frontline healthcare heroes, right, that are dealing with people stricken by this virus, helping to minimize the demand for those services by keeping people where they need to be.
Well, thank you so much for your dedication to the healthcare at home industry over the years. And is there a question that I have not asked you today that you thought I was going to ask you, or something you'd like to say?
Well, as I look forward, from the consumer's perspective, there is going to be a continual shift to these social support services and healthcare services continuing to blend together. And, the future model of care is going to include a wide range of technology with human support to help provide ongoing, cost-effective level of support, right? In my mind, what we're trying to do as a field is provide care management services, right? So if I'm sending an aide into a home to provide some personal care services, light housekeeping, et cetera, that aide becomes a part of the family, right? Almost like a family member, right? We have very long-term relationships with our clients. They become very educated naturally, just like we do with our own parents, for example, around what is the health status. And when there's a change, they become that early warning system. Being a connected part of the community, of their physician, of the local healthcare system, of potentially case management within a health plan, is critical that we're all connected to help continue to monitor and support, the consumer as much as possible. Because I know firsthand, the way the healthcare system has evolved, it had focused on the crisis. So someone's at home, they have maybe underlying chronic conditions, they have an event. The event requires hospitalization. The healthcare system pours in resources to help get them better. Usually it's not as good as where they were before the crisis. Kicks them back home, and then you have a family member saying, what do we do now? How do I keep mom at home, for example, who may be living, out of state? Those are issues, and then the cycle starts all over again. Breaking that cycle through a holistic level of care with multiple modalities, technology, as well as, personal support, are going to be where I see healthcare going. Because at the end of the day, it's pretty simple to me. You want to stay at home, right? You want to be, where you have a community, where you have family, where it's known to you. As soon as you make a conscious decision to move out of your home and do some level of senior care, and sometimes it's made for very good reasons. Those are, what I've seen is a natural decline in health function, the more loss of independence a senior has. So the more we can do to kind of keep people in place and support them effectively, I think, the better quality of life, first and foremost, as well as, frankly, better, cost management for the healthcare system, which is important to us all.
I'm going to ask you one more question, and that is about safety protocols that your staff at Help at Home goes through prior to or in the course of their work.
Sure. No, great question. First, and I'll talk about that in regards to the pandemic as well, which I think is important. When we recruit and hire an employee, one, we go through, significant screening and training of all of our caregivers, which includes fingerprinting, background checks, et cetera. The training is very important, right, to make sure that our caregivers have, frontline care. And often our caregivers have been caregivers, their whole life. Maybe they've had a family member who they've cared for at home, or a child who has been maybe developmentally disabled, or have experience in the acute care setting or skilled setting, as a nurse's aide, for example. Once we go through, that training, then we work very closely with our clients, our caregiver, to provide ongoing support and supervision of the level of care in coordination, for the most part, with third-party case management organizations who are assessing the client for need and helping to develop care plans. So it's a combination of how we screen and train our caregivers, as well as supervise and monitor and provide ongoing training to our caregivers and work in connection with case management. Within this pandemic, my first focus was on how do I keep employees safe? Because these are frontline caregivers that need to continue to do their work. One, infection control and reinforcing universal precautions and training was critical. If you go to our website, www.helpathome.com, you'll see quite a bit of some of the training that we've enhanced to provide ongoing support to our caregivers on just fundamental universal precautions that they need to follow, hand washing, many other things. We've also now we've purchased approximately 2 million units of PPE, which is personal protective equipment, becoming very well-known term these days in light of the pandemic. All of our caregivers have masks, gloves. We also have enhanced PPE if our caregivers are supporting COVID-positive clients, what's called N95 masks, face shields, gowns, et cetera, to help protect our caregivers. We also do screening before every visit, where we check on the client to make sure the client isn't exhibiting any symptoms of illness. So that's another way we keep our caregivers safe. Now, from a client's perspective, we also screen our caregivers before every instance of care to make sure they haven't been around somebody who is showing the symptoms or has a positive diagnosis of COVID, or to make sure that they're not exposing unnecessarily the client to any infection. So very critical today, that we do our part, to minimize the risk of transmission. So hopefully that helps, answer. But we feel pretty good about the safety of our services. And one last point, we've also been able to procure enough PPE to also provide for our clients. So when we're providing care, we actually have our clients wear masks as well, which is helpful to avoiding any transmissions.
Well, I will tell you that it is leadership like yours that makes me feel very, very comfortable to continue to recommend healthcare at home and to help consumers who are looking for a way to help choose home as a place to receive care. So, Paul, I want to thank you so very much for your time today, and I'll let you get back to your busy schedule because I know you've got people out there to protect and people out there to serve. So thank you so much.
Marilee, thank you so much, for the time to talk, and we'll look forward to talking to you again sometime soon.
Yes, sir. Have a great day and stay safe. Thank you so much for listening today, and a special thank you to our sponsors and partners, National Association for Home Care and Hospice, Access, and CoreCute. If you have not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We're also now on Spotify, so check for us there. Like and follow us on social media and join us. Want you to spread the word and help choose home when care is needed.